All right. Well, we're 5 minutes past the hour. So with that, let's get started. Good morning, everyone. Thank you so much for joining today's webinar. My name is Keisha Bradford. I am with Health Center Association of Nebraska, and I am joined by my friends and colleagues in Iowa and Wyoming. From Iowa, we have Erica Shannon joining us. And Erica, would you like to say good morning and maybe a few quick words?
Yeah, thanks, Keisha. We are happy to be joining in this endeavor with you. We know everybody has been up to their eyeballs in COVID and providing excellent services and care to their community. So we are pleased to offer this opportunity for some resources for you all to think through the response you had to the COVID-19 pandemic, and also to check the list on one of your tabletop exercises by doing this after action review as well. So thanks everyone for joining, and I will turn it over to my colleague from Wyoming to introduce herself.
Hello everyone, Hannah Wicke from the Wyoming Primary Care Association. Just want to say thank you to both Nebraska and Iowa including us in this webinar. I think the content is really relevant and timely, so I'm just looking forward to today's presentation. Thank you.
Awesome. Thank you, Erica. Thank you, Hannah. Again, if you missed it, today's webinar will be an hour and a half. It is recorded, and we definitely just want to say be prepared to participate. There's going to be some polling questions just to make sure that you're listening, and also just get your involvement. As you all know, we're in the middle of COVID, and this is has activated your emergency preparedness plans. And so we're all here to learn together. Today we are joined by a couple speakers from Connect Consulting. And before I turn it over to them to introduce themselves, just want to be sure and do a quick reminder, please be sure to mute your lines. And also, if you haven't done so already, please enter in your name, your organization, and what state you're with, as this is our way of taking attendance, if you will. And so with that, I will go ahead and turn it over to Amanda and Karen with Connect Consulting. Thank you.
Good morning, everyone. This is Amanda Cooper. I am joined by my colleague, Karen Garrison. Today, we're really excited to talk about kind of the after-action evaluation process and improvement planning. The great thing about this webinar is that it is applicable to any kind of incident that your organization may endure, most namely COVID right now. So we're going to kind of talk you through this process in really, non-emergency management jargon, because I know that can be really difficult if you don't come from that field. So we wanted to lay this out for you, not get too far into the weeds, give you a solid understanding of how this works, while not giving you too much to overwhelm you. So today we want to start with, actually, can I get everyone to mute their phones? I'm actually getting a lot of feedback. Let's see. Okay. All right, that sounds better. So first, let's start with some introductions. As I mentioned, again, I'm Amanda Cooper. I have been at Connect Consulting for the past, 2 months. I have a master's in public health. I'm also a certified ADA coordinator, as well as a certified ADA professional. Here at Connect Consulting, I'm a planning specialist, so I focus on writing emergency management plans and emergency response plans for our clients. And some of those could include an emergency operations plan or a continuity of business plan, that sort of thing. Planning is my background. Before I came to Connect Consulting, I worked for FEMA, the Federal Emergency Management Agency, where I served as a senior advisor to federal coordinating officers and chiefs of staff I was part of a type 1 response team, which is a response team that's made up of about 30 individuals, and we are reserved for the worst of the worst disasters. So I was the lead senior advisor for Hurricane Harvey in 2017. Most recently, the Camp Fire that was in Paradise, California. So I served with FEMA for more than 10 major disasters over my time with them. And before that, I was a public health emergency manager for the state of Alaska for about 10 years, where I had a focus on preparedness. I was the I was the planning section chief. And I also focused on and served as an ADA consultant for the Department of Public Health, and focused on increasing access and inclusiveness in disaster management. So focused on public health and access and functional needs. I'm also an adjunct instructor for FEMA. And I'm happy to be here. So I'm going to turn it over to Karen Karen to do her intro. And then actually we wanted to add a short intro for our CEO, Nora. And Karen, I'm going to turn it over to you.
Thank you. Good morning, everybody. Wanted to just say hello, and so happy to be here this morning. I am the Director of Aging Services for Connect Consulting Services. Because we work with so many healthcare providers on the clinical and community-based side, it kind of makes sense that we have a Director of Aging Services. In my past, I have about 30 years of experience running programs for older adults and disabled adults, mostly in the San Francisco Bay Area. So everything from skilled nursing facilities, memory care, assisted living, ADHD and CBAS, ADHD adult day health centers in California are called CBAS centers now. It's a managed care system, supportive senior housing, and clinical case management. So these are all programs that support the clients that you serve. These are some of the supportive services that come into play to support your patient populations. I joined Connect Consulting Services in 2017, and I think because I come from the provider community, I really like to think that I'm, that we're, as we develop tools, toolkits, templates, all of those, and plans, that we bring that provider experience to those projects. So at Connect, I actually have do emergency planning as well, creating emergency plans for organizations. I work on quality assurance and CMS compliant reviews. I also lead public sector grant development, articles, blogs, and all of that. Anyway, really happy to be here, calling in from San Francisco, or we're based in Sacramento, about 90 miles. So I'm happy to be here today. And that's about it. Thank you.
Hi, I'm Nora O'Brien. I just want to say hi. Some of you might know me. I used to work for the California Primary Care Association feels like a million years ago, but it was 11 years ago that I actually led the H1N1 outbreak for the California Primary Care Association, and then later started Connect Consulting. But we work with, I'm a certified emergency manager and a master's degree within emergency management, done a lot of activations as well. Maybe not as many as deep as Amanda has, but we are so thrilled to have you all join us today. And the whole point is we're hoping to give you some tools and resources to make your process better for process improvement, and also, making sure you're ready for the next disaster, whether it be we're going to continue event of COVID plus whatever's ahead of us. So thank you much for joining us today, and you're in great hands with Amanda and Karen.
Okay, so let's move on to our next slide. So we wanted to have an interactive process. So we wanted to do some polls and find out where you guys are located. So there's two ways you can respond to the poll. As you can see, you can respond at the website listed above, or you can text to Amanda Cooper 855 to 22333 just to join. And once you join, then you can send a text either A, B, C, or D located where you're at. And we should see results coming in. Excuse me, sorry about that. Ugh, I'm a little far ahead. There we go. All right.
Wow.
All right. Give everyone a second. We'd love to have your feedback. Something else I will mention is that we will be having a follow-up survey once this webinar has completed. We would love for you guys to give us, less than 5 minutes of your time to give us some feedback so that we can improve on future webinars and services and things of that matter. All right, looks like we're still getting some answers. I'll give you guys another minute, another 30 seconds. All right. Okay, well, it looks like we have a pretty good turnout from each. Oh, it's moving again. I have a feeling it'll still, we'll get a few here and there, but good representation from each one of the states. I'm so glad to have you guys here. Look at that.
Wow.
There it goes again.
This is real-time statistics.
It is. Nebraska, Wyoming.
Kind of exciting,
Nebraska,
actually.
Wyoming. There we go. It's kind of fun to see. I love the interactive process of this. All right, so like I said, we've got good representation from each one of the states. I was curious if we would see a D, an other, which it doesn't look like we will. So looks like we kept it within the community, the health centers and the primary care associations that are going to be here today. So great, what an awesome turnout. Excuse me. All right, so let's move forward and talk about our agenda today. So we're going to begin. Karen's actually going to begin. Karen has such a strong background in CMS and HRSA, so we wanted to hand it over to her to have her do some discussion about that. And then I will take over and talk about, the incident command system. If you've never heard of incident command system, this will be just a basic outline overview of what that is and how that is utilized to manage incidences. Also, we're going to talk about the incident action planning and process, as well as the incident action plan. And then we're going to finish up talking about how to do an after action review, writing an after action report, and developing your improvement plan. So with that, Karen, I'm going to turn it over to you. Oh, one more thing. Oh, I forgot. We have another poll here. So what are you looking forward to learning today? And again, you use the same methods that you did before, either by text or by web. So we would like to see what everybody is looking forward to learning.
This is actually a really fun way. It's very like in the moment, which is great.
Okay, he can, Jack, just let him play. Okay, Colin, it's true.
All right, let's see. I'm going to take this as you guys are so excited about this content today that you just want to learn all of it. That's what I'm going to take this as. But if you don't want to participate in this poll, that's perfectly fine. We have a couple more left in the presentation. So
Amanda, I don't know if anybody else is up. It looks like somebody just typed in the same thing. I'm not seeing anything on my screen either. So
okay,
maybe we just move on this one.
All right, no problem.
Sure.
All right, so I gotta click outside of that. Karen, I'm gonna hand it over to you. Take it away.
Okay. Hi, everybody, again. By the way, there's a halo over my head, and that seems to be because I'm in my living room, and it's that moment in time. So please disregard the right up here. anyway. So I have to say, all of the CMS preparedness requirements seem very, very timely at this point with COVID. We're in the midst of COVID. And so, and also we've just rewritten our toolkit, which is some of the foundational documents we use for planning projects. And I'm saying that simply because we're seeing the connection between things like how policies and procedures impact care, impact planning, impact our ability to relax regulations and things like that during a time when everybody is in full response mode. So of course, in 2017, CMS instituted the emergency preparedness requirements for 17 provider types. So we're everywhere from hospitals, ambulatory surgical centers, skilled nursing, all the way to home health, and also FQHCs and primary care clinics. These were instituted, as you guys know this, these were instituted to create a standardized response and planning and recovery strategies for all of these healthcare providers. And the reality is that primary healthcare clinics interact with all of these CMS providers at one point. They're doing referrals to dialysis clinics. They're doing referrals for skilled nursing or, you know, more higher level care. And so you're part of that healthcare system that actually is, you know, the goals of these regulations are not to put undue burdens upon providers, but they're to make sure that everybody is doing having a standardized response. And so we're going to do that through conducting risk assessments and planning. So those hazard vulnerability assessments that are required every year are really important to kind of look at, take a snapshot of where your county or where your clinics, you know, risks are. Is it in flooding? Is it in wildfires? In California, it's wildfires. Or earthquakes, or floods, or whatever that hazard is. And so it's really looking at those risks and creating plans and mitigation strategies so that you can actually overcome those and continue to serve the communities that you're serving. Also developing policies and procedures. There are 4 key policies and procedures for health clinics. So we have safe evacuation. We've got shelter in place, which those 2 don't really apply to COVID very much, but we also have use of, medical documentation, which is basically in a power outage when you lose all your power because of a hurricane or a tornado. You can still serve those your constituencies through going back to paper. You know, because so many of our clinics are actually using electronic medical records, it's really important to have those backup systems in place. And also use of volunteers, which is a kind of a misnomer from the CMS side, I believe, because it's really about medical credentialing. And that's where during the time of COVID, you're definitely going to be using, you might be using volunteer doctors or nurses within your site. To kind of help with your medical surge, what's going on, whatever's going on in your community. And so it's a way to have a system of credentialing volunteers that are, you know, medical to help out your health center. Also creating a communication plan that's updated and robust so that you understand who you need to communicate with, where those numbers are. You want to make sure that those communication plans are updated on a regular basis so that you can, in an emergency, you know who to call. And that's a Ghostbusters thing. However, it's really about who do I call? How do I get that person in an efficient and quick way so that you can get the resources and communicate your needs. It's also about communicating to family members, you know, internal and external contacts, maybe referral sources or vendors that you need in time of emergency. And last but not least, it's training and plan testing. So that sounds like I'm testing something. No, it's really about testing a portion of your emergency plans, a portion of all the things that we just talked about. Do they really work in an emergency? And so training is that pre-orientation, you know, when you hire a new staff person, but it's also that ongoing staff training. And then testing is really exercises. So a tabletop or a full-scale exercise, whichever is appropriate for your site. And I have to say, like, this is part of that training, and this is part of that exercise and evaluation piece. So that's CMS. I really do believe you know, there are a lot of creative ways to use your emergency plans, your PMPs, your communication plan, and then to test robustly. So that's CMS. There you go. Okay, and HRSA has also emergency preparedness requirements. So, you know, some of the new requirements are about formal agreements between CMS and health center providers. So it's really creating MOUs, memorandums of understanding, or mutual aid, MMAs, mutual aid, so that again, you've got the infrastructure in place to continue seeing your patients, to provide continuity of care, and to also keep up with the compliance requirements during disaster. And it's really a way to leverage CMS requirements and HRSA resources. So you're kind of taking HRSA resources and leveraging those with the CMS requirements. And really the goals at the end of the day, everybody, is that you're taking your existing documentation, your infrastructure around emergency preparedness, and you're activating that into a place where you can actually, you know, continue to serve your community. That's, at the end of the day, that's kind of where we're at. Okay, go on. I think I'm done. Amanda.
All right, thanks, Karen. And Karen will be with us for the duration, excuse me, of the webinar. Should you have any questions when we get to the question portion of the presentation.
Very good.
Okay, so now we want to talk about the incident command system. We're going to do an overview like I mentioned before. So the incident command system in emergency management, it's referred to as ICS, although the first rule of emergency management is that you don't use acronyms, but we're the most guilty of it. So I'm going to apologize in advance. Karen, if you hear me use an acronym, or Erica, or Hannah, or Keisha, please stop me and let me know.
It's an easy trap to fall into.
It is very easy to fall into. All right, so let's give a little background. So the incident command system was actually developed by the U.S. Forest Service. They were finding that while they were fighting wildfires, there wasn't a standardized way that they could communicate and ensure that they had efficient management of a wildfire. There were so inadequate management and poor communications were identified as the greatest failures in their response. So they developed incident command system, which now is wonderful. It is a standardized system now to manage incidents. And it was actually adopted by FEMA in the early 1980s, FEMA being the Federal Emergency Management Agency. So this system has been around, you know, for about, let's see, we're already 40 years. And like I said, you can, everywhere from small towns will use it, smaller counties, to all the way up to the federal government. It actually has, it's a management system, and it's designed to enable effective and efficient incident management. It integrates a combination of things you have in a disaster: facilities, equipment, personnel, procedures, and communications, all operating with a common organizational structure. So there's, it's normally structured into 5 activities in 5 major functional areas. So first we have, excuse me, our command. And command includes your incident commander, who is really the head of the disaster's response, making sure that things are getting done. You also have your safety officer. You always need a safety officer to make sure that you're operating your operations in a safe way. And it's interesting because although the incident commander is the lead of the operation, the only person that can supersede the incident commander is actually the safety officer, because safety and protection of life is always the number one goal and focus in emergency management. And then you also have a public information officer that is utilized to liaison with media and things of that sort. And then you could have other liaison officers depending on the response, whether it's a liaison officer to the Department of Public Health or to law enforcement, things like that. And that, you know, these are positions that you can either add or take away from because you may not need in certain responses. And then you also have any other appropriate specialists. So for example, you may have an attorney that's part of your command group that gives you guidance on ensuring that you're following the laws. And so when I served with FEMA, I actually fell under the command structure. I was a senior advisor on inclusive emergency management to the incident commander and federal coordinating officers. Another specialist you could have is security and things like that. So now we go to our operations section, and our operations section is responsible for managing all the tactical objectives outlined by the incident commander. So, and we'll get a little bit more into how those objectives are developed once we get a little bit more into incident action planning. Then we have our planning section, which is where my background is. And the planning section is really responsible for collecting information, evaluating that information, and disseminating that situational information and intelligence to the incident command. And that intelligence is what develops the incident action plan. We have logistics. You can't run an operation or a response without logistics. Logistics is kind of they're responsible for overseeing, acquiring, and providing resources such as staff, desks, computers, food, things like that. They keep all of us running during a disaster. And finally, we have our finance and administrative section. Finance is pretty self-explanatory. They're looking at the financial assets and the accounting for all the expenditures that you have during a disaster. And also the administrative piece, that's where our HR usually is located within that section. So the great thing about the incident command system is it allows its users to adopt an integrated organizational structure. So something that happens in disasters is sometimes you have multiple jurisdictions or organizations responding to one disaster. So this incident command system gives a good common operating system for everybody to work together when you have unity or unified command, which is different, like I said, different organizations coming together. The nice thing about it is not hindered by jurisdictional boundaries. And when you utilize the best practices, ICS or Incident Command System ensures three things: the safety of responders and others involved, the achievement of your objectives, and efficient use of the resources that you have. ICS also applies to all phases of a disaster, so whether it's preparedness, response, recovery, or mitigation. And it's flexible, scalable, and adaptable. So you can customize it according to what the disaster is, and you can use it for any disaster regardless of the size, location, or hazard. Okay, so this is a basic incident command system structure. Like I mentioned, we have our incident commander, who is the lead of the response. And then you have your command staff, which is your safety liaison and public information. And then right below that, you have your functional areas, your operations, planning, logistics, finance, and admin. Now, it does represent kind of a, hierarchy or an org chart, but that's really not in the sense of a traditional org chart. This is a little different. So you have your safety officer, your public information officer, and your liaison officer. They report directly to the incident commander. But when you have your functional areas, they do not report to your command staff. They report to your incident commander. All right, so let's talk about the features of Incident Command System. Again, we want to use common terminology, no slang or jargon or acronyms. You want to stay away from that because a lot of the time when you are doing a response to a disaster, you have organizations that come in that are not from the emergency management side. For example, Salvation Army will come and be part of Unified Command, and they are not they don't live and breathe emergency management every day, so that jargon is not familiar to them. So you want to make sure that everybody has the best situational awareness by using terminology that everyone can understand. We also have a modular organization, and it's really that organizational structure that keeps the response running the way it should. Within ICS, there is a strong aspect of chain of command, which I'll get down to in just a second. I skipped management. So you manage by objective. So for each operational period, which for your some disasters could be 12 hours, for this response, more likely for your organization, it will probably could be 2 weeks, it could be up to a month. And so during that operational period is when you decide what are your objectives that you are going to set out to achieve during that period. And that's how you manage the incident. So now we're down to chain of command and unity of command. So chain of command is that you follow a chain of command. So instead of someone who is in operations going directly to the incident commander, they have to go through their operations section chief, who then can respond to the commander. And that's, again, that's that structure that keeps everything running smoothly and efficiently. You know, and also within unified command, you want to have your manageable span of control. And span of control, at least within the FEMA world, is in order to adequately supervise and coach and mentor the staff that you supervise, they limit the number of staff you can supervise to 7. They want to make sure that you, again, have enough time for each one of your staff. So if you have more than 7 staff reporting to you, they will ask that you add another supervisor within there to split that, that group. You also have pre-designated incident locations and facilities. And that usually is a joint field office, which is where the different organizations or towns or counties come together and they work together in one office, which is different from your emergency operations center. Your emergency operations center is really the heart of the response. In that, the emergency operations center is generally set up much more quicker to the response.
Okay, now since we've gone over the structure of Incident Command System, let's take a look at the features of Incident Command System. So one thing that is pretty common among emergency managers and those who work in emergency management is using sort of emergency management specific terminology and acronyms. So one thing to keep in mind, and something that we encourage among emergency managers as well as the public, is to use common terminology. You don't want to use acronyms, you don't want to use slang or jargon. And this really comes into play when you have other organizations that have joined in the response and you're working together. So for example, you know, your local Office of Emergency Management may have this emergency management / slang that they use. But when you bring in outside partners, let's say the Red Cross or the Salvation Army, those aren't terms that they're familiar with. They don't use that jargon and that slang and those acronyms in their everyday business. So you're really not able to communicate effectively with them. So just remember, slow down, use full words instead of acronyms if you can, and just make sure that you are using the most common terminology that's possible. Something else to think about is modular organization. The thing with Incident Command System is you can kind of organize your staff into sections. Like I mentioned before, you have those 5 functional areas in the Incident Command System, which are operations, planning, command staff, logistics, and finance and admin. So it's nice that you can organize staff among those 5 sections so that you have an efficient chain of command, which is something I'm going to talk about in a moment. ICS, or Incident Command System, is really the way that it's structured is you manage by objectives. So, and I'm going to get a bit more into detail when we talk about developing an incident action plan and what goes into that. You're really managing an incident based on objectives that you have determined and set out for an operational period. Again, I'll get more into detail when we get closer to that. Chain of command is really important. Also unity of command. So again, when you have not only your organization working, but your organization in conjunction with another organization, it's really important to maintain that unity of command, and also chain of command. So chain of command is, if you need something, you go to your supervisor. You don't go outside of that chain of command to get a resource. You don't go above your supervisor unless they're not there or they've given permission. You follow that chain of command. And the great thing about that is it limits, it's more efficient. It's much more efficient. And also it gives people and those working a disaster a knowledge of who to go for and for what. It's a very clear set out chain of command. Let's also talk about pre-designated incident locations and facilities. So normally during a disaster response, the broader realm of emergency management, they have typical offices they set up. One is a joint field office. There's also an emergency operations center. So if you have those locations identified pre-disaster, you also need to have alternates in case those first primary locations have been, made unstable, say by an earthquake, or you're not able to get to them. Having those facilities and locations pre-identified is fantastic. So when you go into your initial response, that's not something you have to worry about. You know where to go, you know where to send people, and once you get there, you start the response. It's also great for resource management, and resource management is not just supplies or cots or pens, things like that. It's also looking at your staff. So ICS is a way of organizing your staff. Again, modular organization. So you can manage those resources and know where all your staff are at all times, know where you can get extra cots or paper, things of that nature. It also helps with information and intelligence management, and that really falls under the planning section, which we'll get into a little bit detail as we go on. You want to make sure, and one of the benefits is that you have integrated communications. So again, when you're working with another organization, you make sure, and ICS provides a way for you to have communications that are accessible to everybody and are integrated within everybody working on the response. Also, it makes sure that you have accountability. So like I mentioned before, you know which staff is responsible for what, so that those staff remain accountable for the things that they need to provide for the response. And it also provides a process of demobilization. So once your disaster is done and you're ready to move on, recovery's over, you need to shut things down, it provides a structure for doing that, which is called demobilization. All right, so now let's look at, so those are the features of Incident Command System. Now let's go and look at the benefits of Incident Command System. So incident command system, it's great because it manages planned events or unplanned events. So for example, a planned event would be like the Super Bowl or any sort of political convention or anything that you know will have a mass gathering, say the Indy 500, things of that nature. And an unplanned event, obviously, is something like an earthquake, a hurricane, things like that. And it's great because it manages those planned and unplanned events of any size or type. And it also establishes, like I mentioned, that clear chain of command. It also provides interagency and interdepartmental integration. So you have personnel from different agencies or departments that can be integrated together to provide a unified structure so that they can effectively address issues and delegate responsibilities. It also provides logistical and administrative support to operational personnel. So when you have staff out in the field, they know the chain of command and they know where to go if they need a resource. It also ensures that key functions are covered and eliminates duplication. So often in some realm of business, for example, public health, it's really easy to work in silos and not be aware of what other people are doing. So the benefit of incident command system is you eliminate those silos. So all of your the command staff and the incident commander and all of those functional areas make sure that the key functions are being covered and making sure that you're not duplicating resources in other areas. That is really just a waste of time and resources. And something to keep in mind is that although incident command system organization looks like a hierarchy, it's not, like I mentioned, it's not a org chart in the traditional sense of it. So it does not correlate. So if you're working a disaster, your incident command system title may not correlate to the administrative structure of the agency or your daily duties. So your normal daily duties will likely be very different from your incident command role unless you're working in an emergency management agency. So one of the things that we recommend and is common in incident command system is that your CEO or your COO, that they are not serving in the role as your incident commander. It seems a little counterintuitive to say that, but really what you're looking at is your incident commander needs to be able to focus on the response 24 hours a day, 7 days a week. And that can be really difficult for your CEO or your senior leadership because they're responsible for the whole of the organization, not just that piece where they're responding. So it allows them the opportunity to also keep an eye on a response of what's going on to whatever hazard has come up, but also being able to keep control of the entire agency as a whole. So now that we've covered an overview of the incident command system, now let's look at, we're going to go a little bit more in depth and looking at how you manage an incident, because this will really feed into your after action review and your improvement plan. So incident action planning. So what you do in a disaster as part of the incident command system is you want to develop an incident action plan. And that basically is a document or a series of documents that tells you what you're going to do and how you're going to do it and what resources are required. Kind of the who, what, when, where, why, how of a disaster. So to develop your incident action plan, you actually have to go through a process called the incident action planning process. So there are steps within that process. So first, what you want to do is you want to assess the situation. You want to know what's going on. You want to determine who's been impacted, how bad is the impact, things like that. Once you have a good working knowledge of the impact of the disaster, then you can go into with your team and establish your incident objectives. So the incident objectives are actually established by the incident commander or unified command for the initial operational period. And an operational period, really, the length of an operational period really depends on the nature of and severity of the disaster. So for example, I worked Hurricane Harvey, which was a big hurricane that hit Texas in 2017. So our operational period was 12 hours. So every 12 hours, we would reevaluate our objectives and alter them or edit them as needed. But for things like COVID and for smaller organizations, your operational period could be a week or it could even be up to a month. You just have ongoing communication on those objectives to make sure that you're still on the right course. After your initial operational period, then you continue to review your objectives and you may validate them, modify them, or even develop new objectives. You also want to determine your strategies to achieve the objectives. So you need to figure out how you're going to utilize your staff and what are your strategies to make sure those objectives are completed. Furthermore, you're going to develop your tactics. So it all kind of, we're breaking it down. We have the incident objectives, the strategies to meet those objectives, and our tactics to meet those objectives. So in developing tactics, you develop tactics and determine the resources that will be applied during the operational period. So for example, during tactics, you decide, okay, I need 6 staff members to work on this objective during this operational period. For an example would be the correct resources assigned to complete a task and perform and have their performance monitored. Next, you want to review and approve the operations plan and the resource assignments that you identify during your tactics. The operations plan is approved by command staff as well as each of your functional areas. And once that has been validated, then you disseminate, execute, evaluate, and revise the plan. So if you look to the right of your screen, that's what is called the planning P. So if you look at the leg of the P, that initial first 6 or so steps, that is only conducted once, and that is in your initial response. Once you have completed that, then you go up to the next step and you just repeat that cycle every operational period. It's a cyclical process. And once you have done that, you've basically identified your incident action plan. And so your incident action plan is actually put together by your planning section. So next, let's look at your incident action plan. So your incident action plan formally documents your incident goals, your operational period objectives, and the response strategy that was defined by the incident command during your response planning. It documents your goals, objectives, and strategies. It is intended to help the incident management team establish and communicate their response objectives. It helps them identify response needs and resolve any obstacles that may be in the way of meeting your objectives. The incident action plan facilitates dissemination of critical information about the status of the response and assets. So this is a document that goes out to every person working a disaster so that they all have a common picture of what they're working towards and how it's going to be achieved. It also contains objectives for the current operational period that you're working in, and supporting information for that operational period. Like I mentioned before, your resources, your staff, your people, things of that nature. And when you're developing your objectives, you want to follow the SMART model or something similar. So you make sure that your objectives are specific, measurable, action-oriented, realistic, and time-oriented. So next, let's look at what an incident action plan could look like. So this is actually an incident action plan template, and it's called a quick start guide. So normally, the incident action plan is composed of multiple pre-identified standardized forms, incident command system forms. But what the quick guide does is it's a condensed version of those forms into one short document. So as you see on the screen, you include the incident name, you include your operational period, you give a brief summary of what's currently happening in that operational period, as well as a brief summary of the incident as a whole. It gives you the option to conduct or to lay out your incident management team, which, as I mentioned before, is your incident commander, and then your command staff, which is public information officer, liaison officer, safety officer, and then you have your 4 functional areas at the bottom. It also has room for the safety officer to give a health and safety briefing. So there, the safety officer really wants to identify any potential hazards, such as inclement weather, things of that nature that could affect the health and safety of your responders and your staff. And then finally, it goes over what your incident objectives are for that period. Again, you have your objectives, your strategies and tactics, your resources, and then you assign that to one single person as the point of contact for that, for those objectives. And this, like I said, really keeps everybody on the same page and gives everyone the information to know what we are working towards. Okay, so now you've managed the incident's over, now what? Now we want to look at an evaluation of your response to an incident. So evaluations are often called an after action review or a hot wash. Hot wash coming from, that's a term that came from the U.S. Forest Service or the U.S. Fire Service when they kind of developed the incident command system. So what is an evaluation? An evaluation or an after-action review is really a review of your response activities. It's really centered on 4 questions. What was expected to happen? What actually occurred? What went well and why? And what can be improved and how? So it's, like I mentioned, it's a review of your activities, it's an informal exchange of ideas, and it goes into an in-depth analysis of what you're going to look at and what you're going to measure, anything you want to measure and see where you can have areas of improvement. So why do we do them? Well, identification of what can be addressed immediately and what can be done over a longer period of time is great to improve your response to the next event. It also identifies your strengths and weaknesses. It will feed into your improvement plan. It will document your any improvements to your process or actually any deteriorations. And many times it's required by licensing bodies and surveying agencies such as CMS. The benefits of doing them is it provides an open and honest professional discussion. There's participation by everybody on the team. You really focus on results of an event. You identify ways to sustain what was done well. It develops recommendations on ways to overcome your obstacles. It builds consensus on issues for follow-up. And it allows you to document lessons learned, which is really important. An after-action review typically should be done as soon as possible, but definitely within 3 months of the end of the event. And the sooner, the better on that. So this is the roadmap of how to conduct your evaluation or your after-action review. So first, we're going to review the steps 1 through 3, which is categorized as the preparation phase of the evaluation process. Then steps 4 and 5, we'll discuss the actual evaluation process, and we'll finish by discussing how to develop the after-action report and improvement plan. So let's start with steps 1 through 3. So you want to discuss, when you plan and organize the evaluation, you really want to define the scope. You want to define the categories by theme, event, or issues. I know it can often be really enticing to think that you're going to evaluate every single aspect of your response. And if you're a small organization that didn't have a very far-reaching complicated response, then you might be able to evaluate each aspect. But more often than not, you have to pick 1 or 2 areas to evaluate. For example, it could be communications. Did we have proper and adequate communications during a response? Or Information technology, was our information technology system enough to support what we needed in the response? So other examples could be you want to evaluate your unified coordination, communications, as I mentioned. You want to identify your stakeholders. It's really important to figure out who needs to be a part of these meetings. You want to select your format. The most common is a debrief. Debriefs are pretty informal. You bring together all the responders and you really just talk about what happened according to whatever you're looking at to evaluate. You want to define your objectives of the after action review, and you want to identify any challenges and best practices that were encountered during your response. You want to document and share experiences of response stakeholders. You also want to identify practical actions for improving existing capacities and capitalizing on best practices. It's also very useful to improve preparedness, readiness, and response plans. You also need to determine how widely you will share the after action report, and you want to determine the length of the after action review. Generally, the goal or the estimate is about 20 minutes per participant. Next, you want to collect data. If you're collecting data, you want to look at your incident information. So stuff you want to collect is response plans for the event. Did you have a response plan in place that you utilized for this event? Any situational reports that you had, and that's where you can reach back into your incident action plans that you developed to kind of give you a situational report and assessment of where you were in that time during a disaster. You want to look and find out your meeting decisions. So if there were meetings that were held during the response by senior leadership, you want to look at what those meeting decisions were and how they impacted your response. One other thing is good to look at is possibly media reports. Again, those will be some sort of tracking mechanism of how you manage the response. You also want to refine your questions. So you want to focus questions under the following categories: coordination, resources, and technical aspects. So some examples of your questions could be, how were, for COVID especially, how were cases and fatalities managed during the emergency? What infection prevention methods were utilized? Were efficient resources available to protect staff from infection? Were existing plans effective in making decisions, determining actions, and communicating information? So you really have a little bit of leeway in what questions you want to define and make sure that they're tailored to your organization. And third, you want to analyze your data. Now you can do this before or during an after action review, depending on the size of your group. You want to develop a timeline for your review. So a timeline of the incident. So for example, with coronavirus, your date of detection, the day of detection that we knew that this was going to be an outbreak, the date that you notified the public that this was going to be an outbreak, and et cetera. You also want to identify existing and new capabilities or capacities, such as were there preparedness activities that you had put into place that were effective, or were any of the plans and policies that you had developed pre-disaster, were those effective, or do they need some sort of alteration? So let's move to steps 4 and 5. So step 4 is actually the time when you conduct the after action review or hot wash. And basically it's an informal discussion. There are some ground rules and I'll go over those in a moment. You want to, like I mentioned before, you want to discuss what was expected to happen, what actually happened, and what went well and why. So it's really important to have active participation during your after action review. It's really important for everyone to participate. Everyone's views will have equal value. There is no blame. You are not blaming whether or not something worked on a person. It's you're looking at the response as a whole. There actually are no right or wrong answers. It's really important to be open to new ideas and be creative when proposing solutions to some of the problems that you identified. You want to develop consensus where possible. And if that you cannot develop consensus, you want to make sure clarification is provided. You want to commit to identifying opportunities for improvement. And you want to make sure that no record of the discussion will be distributed without the agreement of all participants. Quotes will not be attributed to individuals without getting their permission first. So the after action review is not intended to grade your response as a success or a failure. It's really just looking at how you responded in areas that you could improve and also furthering those areas where you did well. So once you're done identifying and conducting the after action review, a great way to close the after action review is by summarizing key points, informing your team of the next actions, and assigning roles for follow-up. So there's one point of contact for follow-up. So step 6, this is when you develop your after action report. Your report should include an overview of the incident and summary of your actions taken, your key findings and lessons learned, actionable recommendations that will improve your process for next time, and the improvement plan should include concrete steps that address the shortcomings identified in the response. And again, making sure that your recommendations are actionable. You also, there's no sense in recreating the wheel, so find a template that works for you and that you can use. We actually have an emergency preparedness toolkit that has 2 templates. They can be simple or they could be multi-page. It's really dependent on your response and your organization. So just for example, this next slide here, this gives a review of the document on the left. This is a more comprehensive after action report, whereas the document on your right is a very simplified 1-page report. So now you've completed your after action report and your improvement plan. So what's next? Once all the corrective actions have been consolidated into the final incident plan, the improvement plan will be included as an appendix to the after action review. Once that's done, then it's considered final and it's ready to be distributed. So the people you want to distribute to, for example, are the people in the response, any participants that played a significant role, and any other stakeholders as appropriate. Next, you want to track the implementation of your improvement plan. So corrective action tracking and implementation captured in the after action report and improvement plan should be tracked and continually reported until it's completed. Organizations should assign points of contact responsible for tracking and reporting on their progress of the improvements or the corrective actions that you identified. And by tracking those corrective actions, you're able to demonstrate to your stakeholders that you've made those tangible improvements in your preparedness and your response. Stakeholders should also ensure that there is a system in place to validate previous corrective actions that have been successfully implemented. And these efforts should be considered part of a wider continuous improvement process that applies to preparedness, response, mitigation, and recovery. So that is your after action review process, your report, and your improvement plan. So I wanted to go over just a brief review of who we are. Connect Consulting Services, that's who we are. We've been in business for about 11 years, and these are all of the services that we provide for our clients. And if you're interested in knowing more information, we have a lot of great tools. You can book a call with us to discuss how we could help. We also offer free monthly webinars. All of our previous webinars are posted on YouTube, and you can click the hyperlink there. And we also provide speakers and trainers. And this is just our contact information should you need to get in contact with us. Book a call, give us a call, anything of that nature. So grateful to be able to present to you today. This was a wonderful opportunity. I do want to mention again that we will have a survey that will follow in your email about this webinar. So any feedback that you can provide us and also provide our hosts today will be greatly appreciated, and making sure that we're providing information that is useful and relevant and applicable to your work.
Can we go to the next, I think the next slide is a question, or if anybody has questions.
I think that is the last slide. I know one question that came up twice in the chat earlier was, what recommendations do you all have on collecting, since it's going to be a longer term emergency, and collecting information over long term and filling out these evaluations in a longer term pandemic?
Well, after action reports and improvement plans are really about a single episode, but I can understand how that, I think it's really about, it all goes back to objectives. So if there's something emergent happening, I think that makes it easier, but these long range, these things that are going on, and we have to constantly kind of create new plans to meet our needs, are something that I think is a bit unprecedented. We are in an unprecedented time right now. I think it's about really looking at those systems in place and what is emergently happening now and reacting to that. I think these systems, in terms of after action reports, are built to be that, again, single activity. And so I think that's a bit of a challenge. I think you can look at short-term objectives and long-term objectives. And I really think once you create those objectives, you can actually start collecting data on those, as appropriate to those objectives. And so I think objectives are kind of the place to start. And again, because we're in an unprecedented thing where it's actually going on for much longer, I think that we're going to actually have to create new ways to think about this. But think about the long game and the short game, and create objectives around that, and then you can track implementation and also collect that data. Does that make sense?
Thanks, Karen. I think that is helpful. I don't know if anybody who typed in those questions has follow-up on that, or if not, we can go
Amanda
back to
might
the
also have
questions
more
folks have.
detail on that.
Yes, I'm back. I'm sorry, technical difficulties. Yes, so I'm sorry I missed the question. I don't know if you want to answer it again, but otherwise we can, I can talk about the survey. Are there any other questions from any of the attendees?
I know Tyler in the chat box stated that he would expand upon that. Tyler, do you have audio capabilities? Yeah, we cannot hear you.
We can't hear you. Yeah. I know the feeling.
Can you hear me at all now?
Yes, we can.
Okay, perfect. I had some technical difficulties here. So I just kind of wanted to expand on that a little bit. My name is Tyler Woodard. I work for East Central District Health Department in Columbus, Nebraska. And, we have kind of a little unique situation here because we're a public health department that's co-located with a community health center. And so we kind of, aggregate everything together. And as you know, as a public health department, we have been operating for this entire time. So it's not like we've had, single incidents where, we get like a patient in that's COVID positive. We have a much higher, strategic level planning around that for our entire region. And so I guess that's kind of where my question was coming from. One of the things we're struggling with is how to, collect all that data for, the months-long response that we had in cooperation with our community health center, and finding some way to synthesize all that information into a single report. That's what we're really struggling with as we kind of transition into maybe thinking about that. So I was hoping maybe you could kind of provide maybe some insight into that. I've written quite a few after action reports myself, but never for anything this long. Usually, it's shorter events. I think, the longest one that I've ever written was maybe, like 20 to 30 days. So was just hoping to get in some insight into that.
Tyler, this is Amanda. That's a great question. So something that comes up a lot in emergency management is it's nearly, for most disasters, it's nearly impossible to evaluate every aspect of your response. That would take multiple after action reviews, multiple reports. It's a big use of time. What we generally recommend is you want to look at what you want to focus your after action review really, and you can do multiple ones if you want to look at multiple areas of your response. But I would suggest prioritizing the areas that you want to focus on to evaluate. And if you can group a couple together, that's great. But once you prioritize, then you can make sure that your after action review really focuses on that number one priority that you want to look at. And then if there's time, you can also have subsequent reviews to look at other areas. But it's a really big lift to try to look at every response you had to the incident. Does that help you at all?
Yeah, that makes sense. Yeah, that's something we had kind of discussed, is maybe narrowing down our focus a little bit.
Right. And I mean, trust me, it's so easy. Even working with FEMA, it's really difficult to narrow that down because you do want to look at your entire response as a whole, which is something you can do. You just do it over kind of a longer term phased approach rather than all in one, trying to cram it all into one after action review.
Awesome. Thank you so much.
You're welcome. Do we have any other questions? I'm not seeing any. So I know that Keisha posted the link to the evaluation. You will also receive an email inviting you to complete the evaluation as well. So if you complete it, but if you've already completed it, please just disregard. If not, the feedback is valuable to everyone involved, all three of your organizations as well as us, to make sure that we can provide you guys with the information that you really need right now. And any other sort of information that you may need moving forward. And we really want to make sure that the information that we provide is tailored to your audience and really can help you take what you learned today and apply it to your work immediately. Again, I apologize about the technical difficulties, but we just keep pushing forward. And I see we have a question. The question, if the emergency plan hasn't formally been activated, is it too late to roll it out at this point with the ongoing COVID-19 response? What would that look like? So no, it's not too late. Generally, depending on the stage of where your emergency plan is at, if it's something that's been completed, then absolutely you can activate it. It's never too late to activate your emergency plan, especially because COVID is going to be around for a while. So what you can do now is you need to identify who you want that are going to be the key players of your organization. Who is your incident management team? Once you identify who is going to be your planning team, your incident management team, then you meet together and you assess the situation to figure out kind of what's going on and where you need to go. And you really start, like I said, at that planning P, where you start, where you assess the situation, you look at where you want to be in a week, a month, things like that. And you just you activate it, and you roll it out now. You know, you can activate your organization's version of the incident command structure. And at any stage of the disaster, I guess, unless you're very near the end, it's always a good time to use your plan, because even though COVID, we've already gone through a lot, you know, it's been a couple months since COVID response started. We're still in response phase for a little while, and this will give you the opportunity to test your plan and see if it looks the same. So start with your planning team, get buy-in from your I see planning team, your incident management team, and then once you guys have an idea of how you want to roll that out, which is that's where you want to inform your other staff and let them know what the plan is.
If I could add something to Amanda,
Sure.
Is that as you activate your emergency plan, that actually is part of that. That is part of the. You actually get credit as an exercise because you've activated your plan. And that's where the after action report is really, really important, because then you need to document what you're doing throughout the activation. And that is actually how you, you know, get that, count that activation as an exercise. And so, and then one more thing is that it's really important. It's really important that you are using elements of your emergency plan so that you can actually use portions. I mean, that's what the emergency plan is for. All your policies, your procedures, your communication plan, your risk assessment, it's all very important that you're using those elements because that's what they're for. Okay, thank you so much.
Let's see, we're about done, but we have one more question. The question is, I think initially there was concern about putting an extra burden on key staff by using the incident command system. Any suggestions on how to address that? So depending on your organization's level of response, ICS is very flexible and adaptable. So you don't need to follow that structure to the T in order for you to get the benefits of it. So something else you can do is you can have more than one staff member identified for one incident command system role, so that you can trade out those duties and say one person has someone is sick and can't come in, you have a backup, and those are typically called your deputies. So you can split those roles among different key staff, so the burden doesn't fall all on one individual. And again, the basic structure of ICS is you can really manage by objectives. So if you just get down with your incident management team and talk about what you want to accomplish and work on your strategies to accomplish that, that is following the incident command structure. Even though it doesn't necessarily look like the standardized model, that's still following the structure. So you make sure that you have follow-up and again, you manage by objectives. Awesome. Okay, so that's it for us. So if you guys, thank you guys so much for bearing with me. And I'm going to turn it over to our wonderful hosts.
Thank you so much, Amanda and Karen, for a very informative presentation. I found myself taking notes and learning things that I hadn't. So thank you both for your time this morning. I know it was early for both of you. We had another comment come in through the chat that I just want to be sure to address, and it was from Tyler, who stated, I would like to add that using ICS really helps other organizations interact with you, because then they know who they should go to for certain things. which is absolutely true. So thank you, Tyler, for that. Also, thank you to all of you who are able to join today. I encourage you to complete the evaluation, as it will help us help you and help us better serve you in the future. Again, today's webinar has been recorded, so a link to that will be sent out. You can expect a link to the evaluation in case you haven't completed it. Sorry, my cat Ariel is joining me. And lastly, you will receive a copy of the slide presentation in addition to handouts. So thank you all for your time. Thank you to my colleagues and friends from Iowa and Wyoming for helping to co-plan this webinar. And with that, we will conclude today's webinar, and we'll be sending out those follow-up resources and materials. So with that, keep on keeping on. Don't give up. We are still in the midst of COVID. We're all in this together. And just thank you for your time. Hang in there. We'll talk soon. Bye-bye.